mental health awareness is great. And this is why we're doing this. But the same thing can happen. We as adults, we go into those Instagram reel holes. We're just scrolling. If we as adults end up doing that, imagine the child that is still developing and their entire lives are social media. So there is benefit to everything. Moderation. They're still children and you're still the adults, and that boundary should be there, even though open communication needs to be there. And so you want to actually be able to express your love for your spouse in front of your kids, because in this society and the culture that our kids are growing up in, we definitely want them to know that parents love each other. Peace should be the goal. I talk about this all the time too. Like, happiness is not so much the goal, peace is, right? You want peace of mind. So, that's more important than whether you won or lost. You want to see how they're treating other people, even family members for that matter. Even if people who wronged you, how are you treating those people? Are you like vengeful? Are you disrespectful? I think those are very important things to know and see if the other person has, because then if they think you're doing something wrong to them, they're going to treat you the same way.
All right, welcome back, everyone. Welcome to our Homeostasis podcast again. Dr. Malik has kindly joined us for a second session, and we really enjoyed the first session. It was a fun conversation. If you have missed that, please go back and take a look at our initial recording. Talks a lot about depression, burnt out, how to deal with tough situations, what Dr. Malik uses herself to keep her mental sanity, and how does she help her patients. So thank you, Dr. Malik, for joining us. I hope we are not exhausting you too much, and this is not going to cause a burnout.
Not at all. Thank you for having me.
Of course. Dive into some of the problems. It says in conversation with mental health expert, but after what I'm going to discuss with you now, it's going to sound like in consultation with mental health expert, because I have kids, 12-year-old, 10-year-old, and most of our listeners, most of our age fellows are dealing with kids at this point. Some of them have kids in middle school, high school, trying to go to college, and raising kids is depressing sometimes. It can take a toll on your health. It's hard to balance the strictness versus the friendliness. And I want to talk a little bit about it. So, my first question to you is something that has become a well known problem these days. And some people think it's overdiagnosed, some people think it was underdiagnosed in the past. And that problem is ADHD. A lot of our kids have trouble focusing on stuff. They don't want to study. They're distracted by the TV or they're distracted by the phone. And they get labeled as ADHD either by their school counselors or teachers or by the parents or by their primary care physician that they see. At what point you believe the kid we're dealing with has ADHD versus general kid curiosity, where they want to explore everything and they can't focus on something for too long and they want to try a different thing every few days?
Yeah, ADHD is interesting because I definitely do think that it was underdiagnosed in the past. And like a lot of the times it's labeled as a bad kid or just a hyper kid or whatever, and not really diagnosed. It is a serious illness and it is a problem. Like, for a lot of especially elementary age kids and stuff like that, and then especially in adolescents too, when they're having hormonal changes as well on top of their ADHD. So there's definitely, it was underdiagnosed in the past. Now, is it being overdiagnosed? Absolutely. Like, everyone thinks, especially adults think that they have ADHD. Not everyone has ADHD, right? And I think part of it is social media and the awareness. Mental health awareness is great, and this is why we're doing this, right? We want the awareness, but it's talked about so much, and a lot of the people that are not necessarily educated on it are talking about it, and that's, I think, where the problem is created, where everyone will then think that it's ADHD. Our issues, even as adults and children, is that we have so many distractions and so much going on. Myself personally, I have two phones. Like, I have like my business line, and then I'm carrying around two cell phones, and that's a lot of distraction right there, right? So for kids, if we look at one school and see in one grade how many kids have ADHD, and if it's a class of 30, maybe 3 or 4 will have it, I don't think that's overdiagnosis. And so
Mm-hmm.
you would have to really go in the classroom setting and actually look at the numbers to really see it. It's just like individually when we realize that our kid has it, that's where it becomes, oh wow, like why is everyone getting diagnosed with it? But
Yeah.
I think it's like important. One, you can get clarification on the ADHD diagnosis. There are psychologists that will do like a full neuropsychological evaluation where they'll look at everything and anything. They spend 8 hours with your child and give a diagnosis. And there's, again, no end all be all, right? It has to be combined with the clinical evaluation, but there is testing that you can get
Mhm.
done, right? I think it's important, especially if you feel like maybe that diagnosis isn't there to evaluate it. One of the biggest things that we see with ADHD is mood swings that people don't know about. So you actually, your child can actually be having mood swings and anger issues, and those go hand in hand with ADHD. When you can't sit still and when you can't focus, you're gonna have like anger outbursts and be irritable because now you're being forced to be sitting in the classroom, but you can't pay attention. So you're going to get into fights and so on and so forth, especially when that happens. So we want to look at the grades and we want to look at fights at school or at home. If that's happening, you definitely want your kid to be diagnosed and get treated, right, for that.
Yeah.
That's going to negatively affect.
Yeah.
Now, do kids outgrow ADHD? Yes, they do. A lot of kids will outgrow it by
Mm.
age 12, 13. Sometimes they actually get more mature and learn organizational skills, especially if they're intelligent, to be able to cope with their ADHD.
Mm.
That's where adult ADHD comes in. So you go through life, you go through your undergrad or whatever, and then you get into grad school, and then all of a
Yeah.
sudden, like you can't focus and you realize that this is really hard. So ADHD will be apparent when the studying gets harder, as or you might see it in children, like if they don't like maths, they're going to be
Mm.
at it, they can't focus in it, but other subjects are able to focus. So it will show sometimes also in that if something's difficult for them, then they can't focus. So
Yeah.
I don't think that it's being overdiagnosed if we look at the bigger picture, but
Mhm.
are people going to get evaluated, especially adults, a lot? Yes, that is definitely how.
Yeah. Yeah. And is it something that a general pediatrician or general practitioner can diagnose, or it has to be diagnosed by a psychiatrist or a psychologist?
So a general primary care physician, pediatricians are diagnosing it, but I think that it would be a good idea, especially now that's being overdiagnosed, for pediatricians to refer to psychiatrists where they can, right? It's not possible because there probably aren't enough child psychiatrists to go around. And a lot of general psychiatrists don't get enough training in ADHD and autism. And so even in my residency, there wasn't enough training, especially in autism, for me to be comfortable. So the child fellowship training was invaluable in that sense. But
Yeah.
if there is an availability, I think that pediatricians should refer to at least get it diagnosed, and then
Mm.
thereafter they can continue to treat it.
Yeah. And medications is the only way to treat it?
That's not true.
Mhm.
So in some cases, yes. If it's severe enough, then yes, there's going to be
Mhm.
medications. Otherwise, there is behavioral techniques and organizational skills that can be taught to kids. So if we're talking elementary school or even before, so we're talking about age whatever 5 to 10, they
Yeah.
can actually have some play therapy where
Mm.
they can learn skills from a therapist that is really good at doing that. Like they have to know how to do play therapy. And so they
Mm.
can learn organizational skills in that case. I have a therapist that I work really closely with. She and her team, they do play therapy. And so a lot of the times when I have kids that I feel like they don't need medication yet,
Mm.
then I will send those kids to her, and she will send me kids if she started seeing somebody and she is okay, no, this kid really needs to
Yeah.
get to the point where I can do play therapy with them. So then they'll
Yeah.
she'll send to me so that we can start the medication process. But yeah, in certain cases, it's, let's say it's not quite like schizophrenia where you absolutely need medication. But if the organizational skills are not being learned and it is severe enough where there's problems happening at school and at home, then yeah, you want
Mm.
to treat it with medication.
And for folks with ADHD kids, do they need to change something at home as far as the behaviors, the patterns, the routines that will help kids with ADHD fight it better?
Yeah, so you definitely want to have routine, right? I think one of the kids that like one of the things that is missing is like our routines are haphazard. So kids with
Mhm.
ADHD, they will focus better if they have a more organized routine. And the parents having more understanding that, okay, this is what's happening. They're just having a hard time focusing rather than yelling at the kids because it's not necessarily going to be, it's going to be counterproductive to actually yell
Yeah.
at them. So like creating those, and then there are actually really good books that are written for parents to read and study and kind of know, like some, just like helping supporting the kid, right? If they're acting out, like if you want to give them timeouts or just not so much, we don't call it punishment, we call it a reward system, that they have to earn rewards rather than punish them. Their social media time or their laptop time, screen time is this much, but if you get this much homework done or whatever the chore or task is, if they're organized and get it done, they earn extra 30 minutes of screen time,
Yeah.
something like that. So we want to do a reward system for them, again, to motivate them to be able to focus and get their homework done. And that's for pretty much any kid, but like especially kids with ADHD that can't sit down and focus.
Yeah.
Putting
And
them in sports is also another great idea, especially if they have the hyperactivity type ADHD.
hmm,
A lot of them, the energy is used up in sports rather
yeah.
than bringing it home and like then just can't sit, and that
Yeah.
energy needs to go somewhere. So putting them in sports, thinking about what their ADHD looks like and picking a profession for them that will be
Hmm,
productive. For instance, firefighters and EMS, ER doctors, they do really good because they have ADHD, because they can multitask and they can just be like their
yeah.
hyperactiveness actually helps do that multitasking kind of job. And that's how parents can actually support the kids, like knowing where their strengths are and where their weaknesses are and focusing on the strengths.
Yeah. So while you mentioned screen time, let's get that out of the way. So what's the decent, acceptable screen time from a child psychiatrist's point of view and an adolescent psychiatrist's point of view that's not going to affect them adversely? What's reasonable? In this day and age, it's really hard to keep kids totally away from the screen when they talk to their friends in school and they're playing all kinds of games and then all kind of TV shows. They feel left out and it makes them feel bad. So what would be a reasonable amount in your opinion?
This is a completely, our Gen Z, our younger Gen Z and Gen A kids are completely different, and our
Mm,
COVID kids are completely different because this is the life that they're living, and what
yeah.
life will look like for them when they're adults and they're our age is going to be, we can't even imagine it, because probably our parents didn't imagine that all of this would be going on with the internet and everything when
Yeah.
we were that age.
Yeah.
The world is changing really fastly, so we have to keep that. That's the first thing to keep in mind. They're going to have friends that are online. They're going to have like entire relationships online. Their games and everything are going to be online. So we have to accept that. That's the first
Yeah.
thing, that we have to accept that this is their life. This is how they live it. They live their lives on social media. That's
Hmm.
just an essential part. So if you're taking that away from them, that's a much huger, like parents will take away, like they will ground their kids by taking away a phone for 7 days.
Yeah.
For
Yeah.
like, we're looking at like adolescence, right? That's a
Mhm.
huge punishment for an adolescent. So you have to modify that in certain ways. Now, what I think is that giving them in the afternoon, like evening time, just about 2-3 hours of screen time or whatever, internet, whatever they want to do. How else are YouTube stars born? They're going
Yeah.
to learn at that age. Otherwise, if you're not giving them that space, they're not going to learn what they want to do.
Yeah.
But like also cutting it off at a certain time, 8 p.m., 8:30 p.m., whatever, they're like 30, 45 minutes or an hour before their bedtime, you got to like just shut it down to where they can't access the internet or their
Yeah.
phone shuts down or whatever it is. So that's one thing, right? The second thing is getting them involved in like sports and arts or theater or dance or whatever it is that they're interested in, so that they have in-person friends and
Yeah.
in-person interactions will get them away from that screen time, right?
Mhm.
In order to like compensate for it. We complain that, oh, kids are not going outside and playing. There's a lot going on in this world where I don't know if I would even be comfortable. I would be very like scared for my child to be playing outside
Mhm.
because the world is just not such a safe place anymore. But
Yeah.
if you're putting them in a sport or putting them in some kind of theater or something where they're interacting in an organized setting, then
Yeah.
they will have friends in person and they will want to do. It's
Yeah.
how, at the end of the day, how you're raising your child as well, not just, what they're doing. So
Yeah.
you
Yeah.
play a huge part in how they're going to grow up. So
Yeah, that's true. Does the type of screen time matters? Like whether they're watching cartoons or Netflix versus they're playing video games and they're like constantly pressured to go to the next level? Does it matter what type of screen time? YouTube?
yeah, so really honestly just limiting it really with gaming, and when kids just get into that like whole stuckness of, okay, I have to get to this
Yeah.
next level and stuff like that, that limiting of the time that they're spending on it is going to be important. Otherwise
Yeah.
they will go down that thing of, okay, now I just need to get to the next level.
Yeah.
But the same thing can happen. We as adults, we go into those Instagram reel holes. We're just scrolling. If we as adults end up
Mm.
doing that, imagine
Yeah.
the child that is still developing and their entire lives are social media, then it's so
Yeah.
easy to get caught up in that. So whatever type that they're doing, you want to monitor it. If, of course, you want to have parental monitoring on it. So if they're watching cartoons, what type of cartoons they're watching,
Mm.
watch it with them to really know, so that you can like decide that is this cartoon appropriate, because they learn a lot from cartoons. Kids will have accents similar to what cartoon they're watching, right?
Yeah.
That's another thing too. I think Bluey or some character in one of these
Yeah.
cartoons has like a British accent. And so some
Yeah.
kids are talking in British accents now.
Yeah.
And then as they grow up, they let go of it, but it's from the cartoon. It's not
Yeah.
anything else. So,
Yeah.
so we want to definitely limit the time, and you want to know what exactly they're watching. You want to have the parental control on it.
Yeah, yeah. And my wife and I have always assumed that we try to keep the kids away from violent games like the gun games, the shooting games, the sword fighting games. Does it really have an effect as far as how violent a kid will be in the future when they're playing games like this growing up? Or is it just hypothetical?
It's hypothetical.
Okay.
There's always a chance of like desensitization. Not all kids, again, 100 kids might be playing it and two or three might turn out to be
Yeah.
somebody that grabs a gun and shoots. You know what I mean?
Yeah.
It seems on an individual level really, okay, this is going to be really bad, but what is the bigger picture? That's what we forget to look at. There's so many kids playing it and one or two went violent. So were they just going to be violent anyways without the video games?
Yeah.
Possibly. When video games didn't exist, we still had violent people.
Yeah.
So that again, like, yes,
Exactly.
avoiding something that you're not comfortable with is
Mhm.
always the better way to be. But if they're absolutely adamant that this game is the game I want to play, then that's okay. What
Yeah.
if your kid does want to go into the army or whatever, into military, and you've not ever let them play this game and that's what they want to do? Then they have
Yeah.
had no exposure or experience. Even like, I think in the military they use video games or some kind of video simulation to help
Yeah.
with the training. So there is benefit to everything. Moderation is key.
Moderation. Yeah. So I know your next answer may be moderation as well, but I still have to ask this because this really puzzles us a lot when dealing with kids. Growing up in Pakistan, and our parents are very strict when it comes to studies. They're always like, you need to get good grades, you need to focus more on studies, and social life and social skills took a backseat usually. But I think we turned out okay. But now we get worried that if we stress the kid too much with their grades, with their performance in school, especially with their academics, they may not turn out to be a well-rounded person, or they may have the negative effect where they start hating books or where they start hating studies. So how do you balance the amount of stress you place on their academics versus just letting them be, and then they decide, oh, I don't want this subject, I don't want that subject, and you're worried that every couple of years they're switching their career goals and they find everything hard to
Yeah.
do because they're not enjoying it.
Yeah. So a couple of things. I have a little bit of a different opinion about the strictness and the fact that our parents didn't let us have like a social life even when we weren't doing anything wrong. We weren't allowed to do it. I think it did affect us in like having other things. We are very limited. I feel that way. My knowledge is so limited to medical. Right?
Mm,
People will have a conversation about some artist or some singer and I have
mm,
no idea who that person is,
mm,
whether it's Pakistani or American. Like I didn't develop like the cultural knowledge because we were
mm,
just so much into our books. So I
mm,
think that's like something that is lacking in a lot of people that were just forced to do one thing and think about one thing.
mm,
Those social skills are important to have. You're not paying attention to anything. You don't get into a habit of I have to force myself. I'm never going to enjoy working out. It's not that I enjoy working out, waking up at
yeah,
5:30. I have to force myself to do it because otherwise we have no activity, but it's because we were just told to sit down and study,
yeah,
right? And so our lifestyle is still stagnant because that's what we grew up doing basically.
mhm,
Like after a while, like it wasn't even badminton anymore. In eighth, ninth, like basically you start studying and you forget about everything else.
yeah,
So I think it's important to have that balance again, like you said, moderation, but then also the world again is going to look so different for them versus us. I think for us, our parents, and maybe they were right because their generation, physicians are very stable and physicians do have made a lot of money and stuff like that. That's not the case anymore. Physicians are
yeah,
not making a lot of money. We all know everyone
yeah,
else's salaries go up adjusting for the inflation, but physicians are actually getting paid less than they were before.
yeah. Not buying yachts and islands anymore.
Yeah, exactly. So that what is it going to look like and who's going to be making the most money? We don't know what's going to happen in like when in 20, 30 years when they're like at that age. So letting them develop their skills and not being so strict and focused on one thing, I think is important. Not everyone is going to get A's on every single subject. They should be able to thrive in what they enjoy. And so if it's, for instance, they enjoy drawing and writing comics, put them in something that school is cool, but maybe you can have an extracurricular where they can develop those skills.
Yeah,
Like just promoting all of it
all
because,
of
we
yeah,
they need something and everything. And especially for I feel like for physician parents it's actually easier because you've put away enough money for your kids for them to be okay to
yeah,
have a good life. We talk
yeah,
about how we want our kids to have a good life and you worked so hard, so why don't you let them actually have a good life rather
yeah,
than just
yeah.
pressuring them to
Yeah,
study and have
and you
grades.
may have seen like these days, especially in our community, I've seen parents being really ambitious. They're taking the kids to spelling bee and chess and tennis, and they're involved in 10 different clubs, and they don't have a single minute for themselves. And the belief is generally the ambitious kids, ambitious parents, and overachieving parents who want their kids to do well, eventually their kids are going to be okay compared to parents who are just taking it easy, taking a back seat, letting kids do whatever they want. In your experience, have you noticed any adverse effect or any negative outcome when parents are being too ambitious and they're getting kids involved in too many things? Do they turn out to be better in the long term? Like they have so many skills, they've learned so much, they joined 10 clubs, now they know chess, they know tennis, they know they were spelling bee champion, or someone who just took it easy, the kid did whatever they wanted to do, and the parents just did not get involved in their decisions.
Yeah. So I think like kids do need guidance, but then we want to let them have a choice. For instance, put them in soccer and basketball and chess, and they decide they don't like soccer and they like basketball and chess. Sure, take them to both. If they like it, if they want to do it. The question
Mhm.
is, do you want to do this? If it's a no, that's fine. Don't pressure them.
Yeah.
I had a parent bring a kid and they were Desi, so that this is very relevant. And the kid did not want to ride bike to school and they have a bike day at school.
Oh,
I don't
really?
understand that. Everyone rides their bicycle to school that day.
Yeah.
And I'm just like, this is so bizarre. I've never heard of anything like this, but fancy
Yeah.
schools. The kid just started crying that I don't want to ride my bicycle to school. And so
Mm,
come to know, they were just not good at it. They were not very coordinated and they were going to fall. And that's what they were afraid of.
that's
So
good.
I
Yeah.
literally just told mom, don't just drop your kid at school. Why are you pressuring them
Yeah.
Not everyone
Yeah.
knows how to ride a bicycle. Not everyone has to ride a bicycle. So let
True.
it go. Let them
Yeah.
do what they want to do. And eventually the kid like did a few things and decided on basketball and they're fairly good at it. Giving kids the option. And then if you're ambitious and you're putting them into 10 clubs and you're driving them everywhere, they're not being able to have a childhood. Sure, they're going
Mm.
to develop a lot of skills and stuff like that, but are they actually having a childhood? So are they actually developing
Enjoying.
fully overall? I don't think so.
Yeah. Yeah.
They're just
And
so
I, true, true. With my kid, what I struggled with was I wanted him to play basketball because I used to play basketball and I could teach him at home, but he did not want to do it. He wanted to play soccer. So he joined a soccer class. I let the kid do what he wants to do. And then after a couple of years, he realized, oh, I don't want to do soccer. Now I want to do basketball. And all the kids who started basketball 2 years ago are way ahead of him now. And now he has to compete with them and catch up. And I feel like, why did you even listen to me in the first place? I told you are tall and you can do better in basketball. We said, no, I want to play soccer, and see where we are at now after after 2 years.
yeah, but that's okay because
Yeah,
then they get to learn, okay, we were behind and that's okay.
yeah,
Like
that's
if
all
they're
right.
behind,
Yeah,
so what?
yeah,
If they're enjoying it, that's the more
yeah.
important
And
thing.
there's another topic where there are two schools of thoughts, and I want to get your opinion on this as an expert. Do you want to be friends with your kids? You want them to trust you and share everything with you because you're worried that if they do something wrong, they may be too scared to come to you. So you want to be friends with them, you want to be casual, you want to be buddy buddy with them, versus you want to be someone that they have a certain degree of fear of. Like you need to have some kind of an atmosphere where the kids listen to you and they want to do the right thing and they're a little bit of scared of you, so they don't do things that are going to get them in trouble. Like, where do you draw the boundary? Some people say, no, you're parents, you're not you're not their friends, you need to be the parents. The friends are friends, parents are parents. And some people, no, that's those times are gone. Now you just have to be friends with them. They have to have that kind of support and comfort at home. Where do you suggest we draw the line between friends versus the parents? Yeah.
I again think that if you're instilling confidence into your kids to be
Mhm.
able to make a choice, I think they learn how to make a choice and they make
Mhm.
better choices. I feel like our parents were so strict and wouldn't
Mhm.
let us, we couldn't even tell them why we wanted to do a thing because they didn't want to listen. That created like weird gap where we weren't open to sharing with them even when we had big problems that we probably should have shared because there was
Mhm.
this like huge gap. So I think again, like meeting them in the middle where you're not their best friend, but they're comfortable enough to come to you to talk about something. They're not scared of bringing something to you and your reaction to when they bring it. So where they stop trusting you is not so much, oh, you're buddy buddies with them, but
Mhm.
also if you react negatively. So for instance, somebody's having using somebody, some kid brought weed to the school, right? And there your child comes and talks to you about, oh, this kid had like weed and whatever. And your first reaction is you start like really negatively reacting and then you go to school and tell who had it, and then now
Mhm.
your kid is like in that situation where all their
It's
peers know that. So then that trust is gone, right? Like
yeah,
your kid will not come to you next time when there is something, rather
yeah.
than you just having a discussion with them at that point, not as, oh, I'm your buddy, let's go smoke weed together, but as, okay, what are the benefits and what are like the drawbacks of trying
Mhm.
this or using this, so that then that open conversation is started, right? Whatever it is, rather than showing that reaction. So there is some amount of friendship and trust, but I don't see where you have to be sharing, going out
Mhm.
of your way and sharing things with them that they don't necessarily need to know. And another thing about like the friendship and being open with your kids, you always want the parents should be first best friends with each other, right? They have to keep a front rather than
Mhm.
one parent being more friendly than the other. So both parents have to keep that front, because what happens is if they're not, then you parentify your child.
Yeah.
So you don't want to do that either. They're still children and you're still the adults, and that boundary should be there, even though open communication needs to be there.
That's a good way into our next topic, and I wish we could talk about this a lot more, but we have about 15 minutes left. So, the parental relationship. You always, whether you're in a relationship or you're married, you're always hoping for the best, and you get into the relationship especially if you have kids, it's hard to get out of that relationship. A certain amount of conflict is expected, it's not avoidable. At what point do you tell the parents, if you ever tell them, okay, you guys need to stay away from each other, you are having this kind of a conflict that's not good for your kid? At what point would you say you need to give up and not try anymore versus keep trying and keep going back to the same square one every couple of years, where you want to get divorced but you don't get divorced, and you want to raise the kids together but you're not doing a good job of it?
Yeah.
What's your red flags when it comes to parental relationship?
Yeah, I think physical abuse is where the line should be drawn always. So
Yeah.
if there's physical abuse, absolutely people need to get out of that, right? And so that's, I think, because whether the kids are seeing it or hearing it, that's going to negatively affect the kids. So as a
Mhm.
child psychiatrist, if one of my child's parents are not getting along, right, and the kid is aware of it and there's so much frustration and so much issues, and they're saying, the parents are saying that we're together because of the kids, then there's something definitely wrong. And if there's
Mhm.
no love between the parents, the kids can feel it, and that's what
Mhm.
they're learning that love should be, or a marriage should look like. So when they become adults, that's what they're going to think this should look like. That's the normal thing, and they'll repeat that. So they're stuck in that cycle of having these bad relationships because that's how their parents were. And so I think that's important to know when it is affecting your kids, where you guys are getting into so many arguments that they're overhearing it, or they can tell that mom and dad are not getting along with them, because the kids pick up on it very quickly, that
Mhm.
mom and dad don't love each other, or don't, are not.
Yeah.
And that's another thing within our like Pakistani community. I was hanging out, like, and this is like more in a social setting with just common friends, and we went on a trip together, and I was
Mhm.
like, I was hanging out more with the kids because I was single at that time. So I'm like
Mhm.
hanging out with these teenagers. And of course, I'm a child psychiatrist, so I'm getting along really well with them. And so they bring up that our parents are always arguing. Like they don't love each other. They hate each other,
Mhm.
and blah, blah, blah. And so I'm sitting over there. And you know how like Pakistani parents and couples don't show like affection at all towards
In
each other.
front of the kids.
And that's actually a negative thing, especially if you're growing up in the US for kids,
Yeah.
because they're like, oh, my parents hate each other. There's no affection between them. And so
Mhm.
you want to actually be able to express your love for your spouse in front of your kids, because in this society and the culture that our kids are growing up in, we definitely want them to know that
Yeah.
parents love each other.
You're glad. Yeah, yeah, yeah. That's funny you mentioned it, because you would see that the husband or the wife is coming back from a trip or something, and they would shake hands or hug everyone except their husband or the wife, because it's like taboo in front of the parents or kids. You don't want to be showing the affection. The PDA is not
Yeah.
welcome in our society, but that has to be shown, huh?
Yeah.
And physical abuse, you mentioned, if it happens once, it's gonna happen again, right? So people think, oh, it was just he was angry or she was angry and it was just a one-time thing, and I think things will get better now. He has promised me, and this is not gonna happen again. But if it happens once, probably it's gonna happen again. So do you believe in second chances in that situation?
Couple to couple, right? You can't say a yes or a no. And I think that if the couple believes that they can give it another chance, then it's okay
Mm,
to give it another chance for them. But they
mm,
should definitely be seeking counseling and professional help in that case, having somebody neutral to talk to,
yeah,
because the neutral person is going to not be on any sides. But if there is physical abuse, again, you want to walk out at that point.
yeah,
And depending on how bad the physical abuse was in the
mm,
first
mm,
chance, right? Because if it
yeah,
was really bad, then it is going to repeat and it'll become a cycle. And
yeah,
so that's also where we talked about boundaries in the last session, that you
mhm,
want to have those boundaries to where it never goes to that point. You, if you're arguing, you're angry, you need to know that you need to take a step away,
yeah,
and your partner should allow that. They should be okay with your boundary of walking away and
yeah.
cooling down, whichever partner it is that has gotten to that point of anger.
Any special techniques you use in an argument to make sure it doesn't escalate, or you say something or do something? Because you can play with the people's mind.
Yeah, you
What
can
do
ask
you
my
use
husband.
like in
He'll
an
say that I
argument to
know
either?
everything that's going on and I'm manipulating everyone and everything.
No, but is winning an argument really important? in some situations where you feel like I don't want to lose the argument every time because I'm losing respect here, versus just giving up and saying I don't want this conflict to escalate. Like, what's a better way to handle the arguments? You always want to lose, you always want to win.
Yeah,
You
so
when you
you
lose.
don't want to not be non-confrontational, because that gets you nowhere. Because if you're
Yeah,
not confronting at all and not
yeah,
having like an actual discussion, then it's going to build up and then there's going to be a blow up. So you want to be able to express yourself, but in the moment, if that situation is getting heated, then you are allowed to say, okay, let's come back to this,
mm,
or we can just agree to disagree on this. Instead of making winning or losing the goal, it's just peace should be the goal. I talk about this all
yeah,
the time too. Like, happiness is not so much the goal, peace is, right? You want
peace
peace of
is-
mind.
yeah,
So, that's more important than whether you won or lost. But also at the same time, you don't want the other person to think that you agree with them, because then you haven't let your point across. If you have a different point of view, I actually have the opposite problem. My husband won't openly say what he actually feels, and that's the problem that we have. And I'm just like, can't you just ask for what you need rather than getting
silent treatment is worse. The silent
right?
treatment.
Yeah. So if you're not like expressing exactly what the problem is, or like what your opinion is, that's going to be a problem in the long run. In the
Yeah,
moment, it might seem okay, I just squashed the argument and we moved on. But in the long run, that's going to be an
yeah.
issue.
Yeah, let's come back to this and let's agree to disagree is what I say when my wife wants to buy something. I say, let's agree to, or maybe let's come back to this in a few months. This is probably not the right time. So, yeah, that's a good way to handle it. Now, coming to the relationships, last few minutes that we have. So, you are also trained in psychoanalysis at Emory University.
Mhm.
And what are people who are trying to get into relationships or they're looking for a suitable partner that they want to spend their life with, whether they're a girl or boy or man or woman? What are some of the things you're looking for in a partner? What are some of the clues in their behavior that would tell you, okay, this is going to be a great partner for me, or this is probably not going to be a great long-term relationship, and this is just a fling or just a flirting?
Yeah.
Yeah,
There's,
what
I
are
think,
some of the personality traits that tell you that, okay, this must be a good person?
so one of the things like is going to be your values.
Mhm.
One, knowing your own values, what your values are, and then seeing if the person has same or similar values, because no two people are going to have exactly same
Mhm.
personalities or same values, but similar values, like on the
Mhm.
main things you're agreeing. And if you do have a disagreement on values, whether you can handle that disagreement and you're okay with it. You can have different political opinions or whatever, but be able to still respect the other person despite them having a different political opinion, and be able to take in what they have to say, what
Mhm.
their opinion is. That's one thing. And the other thing is, I think, friendship, like the friendship and respect. If you are able to respect the other person and the other person respects you, you're able to share your feelings openly with them rather than having to go to a third person to share your feelings with. If you're not able to have that open conversation with your spouse, your partner, then it's not a great relationship if you have to bring a third person in every single time. Sure, if you're
Mhm.
having like a disagreement and it's a problem, that's different. But at the
Mhm.
end of the day, you and your partner should be each other's number one to go to. And I think so. The third thing about personalities, you were asking, it's very hard to match your personality with somebody. So you're going to have differences in personality. That's just impossible. Two people can grow up together. Your personality is
Mhm.
going to be very different from your sibling's personality.
Mhm.
That's just how it
Yeah,
is.
yeah,
But respect, can you respect the other person?
yeah.
Once that respect is gone, the relationship is doomed. You have to be able to respect each other.
And respect, like if you like you go out on a date or you're going out for dinner and you see that guy is getting angry on everyone on the road, or he has road rage or doesn't respect the waiter, or he's mad because the food is late. Are these things that really should matter in your decision as far as the long-term relationship is concerned?
Oh,
Their
absolutely.
behavior with other folks and how short of a fuse they have.
You want to see how they're treating other people, even
Yeah.
family members for that matter. Even if people who wronged you, how are you treating those people? Are you like vengeful? Are you disrespectful? I think those are very important things to know and see if the other person has, because then if they think you're doing something wrong to them, they're going to treat you the same way.
Yeah.
because they're getting into that defensive mode that they are with other people. So they will
Yeah.
treat you the same way.
And does it matter how many failed relationships they had in the past? If someone is getting out of a relationship every couple of years and you think, oh, I'm the one that probably going to stick with me, is that a red flag? Or they might be just, they were just getting unlucky and now they probably found the right person? Like, in your
Yeah, I
view, does
wonder.
it?
So it's dependent on what is going on. Some people are in unstable relationship after unstable relationship because they have like borderline personality or borderline personality traits. And they just have these unbalanced moods and unbalanced like relationships with everyone around them, whether it's
Mhm.
be friends, family, or romantic partners. So are they working on healing themselves?
Mm.
That's the most important thing. You can't be healed. A lot of
Yeah.
people that you're just healed. No, are you working on healing yourself? Are you constantly, is that person that has been through all these relationships and has had all these experiences, are they working on healing themselves? Because if they're not, then yeah, absolutely not, because it's going to repeat. But if they're
Yeah.
working on healing themselves, then yes, they will know how to behave. Also, I wonder if you go to the opposite thing where somebody has been in no relationships and has no experience, how good they would be. It's the same thing. You have no experience at all being in a
Yeah.
romantic relationship. Okay, that's
Yeah.
kind of a red flag too, if you want to look at red
That's
flags.
not going to be easy either. Huh? Because in Pakistan, you might have heard, oh, he doesn't have a job, he doesn't want to work. Let's get him married. Let's get him in a relationship. Or he's doing drugs. Let's get him in a relationship. Everything will get fixed. So probably not the right approach, right?
No, absolutely not.
Yeah.
Absolutely
And
not.
then I think we have a couple of minutes left. One last question, and that's more directed at the physicians, because as a psychiatrist, you probably get a lot of patients who were seeing someone, they were not given the right treatment, or they were not diagnosed correctly, or someone missed the diagnosis. What's one suggestion or advice you have for primary care physicians or non-psychiatrists to follow so they don't miss diagnoses or they refer people at the right time? What are you seeing getting missed the most, and what should we look out for?
Yeah, so I think the most important thing, it's not so much the diagnosis being missed, it's the complicated, not like treatment resistant
Mhm.
people that when you're trying to primary care is trying to treat and they don't know what to do with the medications, or they're just like doing what they think they should do. I think that's the point where you want to definitely right okay, go see a psychiatrist, because a
Yeah,
lot of the times meds are tried and that whole formula that's written on a book is not
yeah,
exactly correct.
yeah,
You want an expert to at that point. If you started somebody on Prozac and it didn't work out, send them to an expert after that instead of trying another drug yourself.
yeah. Because the only couple of things we know as internists is maybe Zoloft, Lexapro, Paxil, but that's pretty much all we do. But I've seen people like switching them around
Mhm.
without getting a psychiatrist on board. You don't think if one medication is not working, probably a good
Yeah.
time to send person to a psychiatrist.
Yeah, because I've had some patients, and most physicians are really honestly, they do a good job of managing it. Primary care has some experience, but sometimes it will get tough and they won't recognize that this is getting out of hand. And I think
Yeah,
that's
yeah,
obviously we probably need our family physicians in primary care to rotate more through psychiatry during their
yeah,
training and ER doctors, but
yeah.
that is like a completely different topic of systems.
Yeah, yeah. Appreciate your time, Dr. Malik. It was really lovely talking to you after such a long time. Very enlightening. I learned a lot of stuff. There are a lot of questions that hopefully we can address at some point in the future. Hopefully, we'll talk again. Thanks a bunch for your time. Thank you, everyone, for listening. I'm sure it was helpful. If you found some value in this podcast, please let us know if you want something similar in the future. Also, please let us know in the comments. We'll talk to you again. Dr. Malik, any parting comments before we hang up?
No, this was great. I appreciate you having me on your podcast. And, I hope to do this again sometime.
Take care.
Thank you.